time with 2 COVID-19 vaccines being rolled out in our state right now, the Pfizer vaccine and the Moderna as well. Keith Grant, the Senior Director of Infection Prevention at Hartford HealthCare, is joining us now. Thanks for being with us.
Thank you for having me.
So I've learned that you just got your shot last week. Tell us how you're feeling.
Good. So I feel pretty good. Just had some soreness at the site within the first 18 to 24 hours, and it subsided. And at this point in time, feel perfectly fine, no side effects.
Tell us, do you think that folks are going to let their guards down knowing that a vaccine is available now? And what advice do you have for them?
So I do hope not. I mean, that's a very, very good question, and I've been getting a lot of those questions across. Is it a natural or human nature reaction that we have to look out for? I think so. And I think we all should accept that that's a possibility and be aware of it in presence in our own actions. So the advice that I would give is, at this point in time, more than ever, is when, we should really be vigilant in ensuring that we practice the way that have gotten us to so far at this point.
Sure, we've made it this far, right? Christmas is coming up, New Year's is coming up, and typically that's a time where all of us really want to see our families. What advice do you have for folks who still want to gather this holiday season? Is there a safe way to do it?
Yeah, so be as safe as possible. A number of individuals has asked whether or not a test. So if I test today, am I safe to go around my elderly grandmother come Christmas? My answer is generally no, it's not. It doesn't. That single negative test doesn't consider the period of 14 days for incubation period.
And finally, just quickly, when do you think we'll see the effects of the immunity among the vaccinated population?
So we're looking at herd immunity. If you look at the theory of herd immunity, we're expecting, as soon as the vaccines start rolling out to the public, and we get a number of close to 50% in certain environments, then we could start really seeing some significant impact on it. But if you look at it right now, if you look at, let's say, simple process, if there's a room with 10 people, and with those 10 people, there's a number of people, three persons that are vaccinated, it breaks the chain of potential infection, right? So if you get infected and there's someone between you and the next person, it creates that singular barrier. So it reduces the potential of actually moving it on.
Thank you so much for sharing that and for all the work that you're doing.
Absolutely. Happy holidays.
And for the latest information about the coronavirus and the vaccine, of course, you can visit hartfordhealthcare.org/coronavirus.